Hello guys, welcome to my channel SwathiPharmaJnan. Today's topic is urinary tract anti-infective agents, the structures of all the drugs we'll see today. For the introduction of urinary tract anti-infective drugs and for the SR of quinolones, you can check it out for the previous videos. So now we'll see the structure of urinary tract anti-infective agents one by one. The first structure under the quinolone derivatives is NORFLOXACIN. In the NORFLOXACIN structure, the basic nucleus is the aromatic ring is fused with the pyridine ring. This structure we'll call it as quinolone. Quinolone indicates benzopyridine with the ketone group is present at fourth position, and here at first position where the nitrogen is present, there ethyl group is attached, and at third position COOH group carboxylic group is attached, and at sixth position fluoro group is present, and at seventh position piperazine ring is present in the structure of NORFLOXACIN. Uses or it is used in the treatment of urinary tract infections which are caused by Escherichia coli and pneumonia and Enterobacter species, Proteus species and Staphylococcus aureus. For all these infections which are caused by these microorganisms, we'll use this NORFLOXACIN. Next is SwathiPharmaJnan. SwathiPharmaJnan is the structure of the drug. It contains a cyclopropyl group at first position, carboxylic acid at third position, and a ketone group at fourth position. Amino group is present at fifth position. Two fluoro groups are present at sixth position and eighth position. And it also contains piperazine ring. This is saturated pyrazine ring, also called as piperazine ring. To this piperazine ring, at second position and at sixth position, two methyl groups are present. That is structure of SwathiPharmaJnan. So here also quinoline is the basic nucleus. Uses or it is used to treat the skin and soft tissue infections, to treat lower respiratory tract infections like bronchitis and bacterial pneumonia, pelvic inflammatory disease which is caused by gonorrhea and chlamydia species. So for all these infections we can use this SwathiPharmaJnan. In SwathiPharmaJnan and CIPROFLOXACIN there is a cyclopropyl group present at the first position. Only these two structures contain cyclopropyl group at first position. Second position there is no substituent. If any substituent has been introduced at second position, then it will greatly abolishes the antibacterial activity. At third position carboxylic acid is as usual, and ketone group is present at fourth position, and at sixth position one fluoro group is present, and at seventh position piperazine ring is present in CIPROFLOXACIN structure. Here Cipro indicates a cyclopropyl group is present, flox indicates fluoro group is present in this structure. Uses or to treat bacterial gastroenteritis caused by gram-negative bacteria. If any inflammation of the gastrointestinal system which occurs by bacteria, then we can use this ciprofloxacin. It is widely used for the treatment of respiratory tract infections such as pneumonia, which is caused by gram-negative bacteria, and it is also used to treat urinary tract infections, venereal disease. For post-exposure treatment of inhalation anthrax, we can use ciprofloxacin. Next structure is LOMEFLOXACIN. LOMEFLOXACIN contains ethyl group at first position, carboxylic acid group at third position, ketone group at fourth position, and it is also a quinoline as the basic nucleus. In sixth position and eighth position contains two fluoro atoms. At seventh position it contains two methyl piperazine ring is attached at seventh position. This LOMEFLOXACIN will show the CNS effects because of the presence of fluoro atom at sixth position. This LOMEFLOXACIN is used to treat urinary tract infections. Ofloxacin is the condensed structure. It contains 1,8 condensation. First position and eighth position condensation is present in ofloxacin. The basic nucleus is quinoline. To this, higher carboxylic acid group is present and ketone group is present at fourth position, sixth position fluoro group, and here methyl piperazine group is present at seventh position. 1,8 position one condensation product is present in this condensed product or condensed ring. There is a nitrogen and oxygen, and one methyl group is attached at second position. That is a structure of ofloxacin. Uses are to treat lower respiratory tract infections and pelvic inflammatory disease. We can use this ofloxacin to treat urinary tract infections which are caused by gram-negative bacteria, and for prostatitis which is caused by Escherichia coli, to treat soft tissue and skin tissue infections which are caused by Staphylococcus species and Streptococcus species. Next structure is NALIDIXIC acid. NALIDIXIC acid is a 1,8 naphthalene, means at 8th position isosteric substitution has been taken place with nitrogen in the place of carbon, and it contains at first position ethyl group, carboxylic acid at third position, ketone group at fourth position, and methyl group is present at seventh position. That is a simple structure of NALIDIXIC acid, but it will show a very powerful antibacterial activity against the various urinary tract infections. In the treatment of urinary tract infections in which gram-negative bacteria predominates. Inoxacin is the another structure. Inoxacin is also a 1,8 naphthalene. At 8th position isosteric replacement with nitrogen has been taken place, and at first position ethyl group is present, and at third position carboxylic acid group is present. Fourth position ketone group is attached, and at sixth position fluoro group is attached, and at seventh position piperazine ring is present in inoxacin structure. It is used to treat urinary tract infections. CINNOXACIN is the structure which contains 1,2 naphthalene. 1,2 naphthalene structure at second position. Isosteric substitution with nitrogen in the place of carbon has been taken place in the CINNOXACIN structure. Carboxylic acid is present at third position, and at fourth position ketone group. At first position ethyl group is attached, and here there is a condensation between the sixth and seventh position. This ring condensation is called as dioxolone structure. It is also used to treat urinary tract infections in which gram-negative bacteria is susceptible. The next structure under nitrofuran derivatives is nitrofurantoin. Nitro indicates nitro group, furan indicates furan group. So nitrofuran group is the name indicates. Next, toin indicates it is a Haydn-Toyin structure. What is Haydn-Toyin structure? Haydn-Toyin structure means imidazolidine 2,4-dione is called Haydn-Toyin. Haydn-Toyin structure and nitrofuran structure both are fused with the C double bond N. That is the structure of nitrofurantoin. It is used to treat bacterial infections, and it is also an anti-protozoal drug. Next structure is methenamine. Methenamine is also called as hexamethylene tetramine. Hexa means 6, methylene means methyl groups, tetra means 4, amine means amine groups. 4 amino groups are present, 1, 2, 3, 4. And 6 methylene groups are present. Totally they will form into a one structure, that is methenamine structure. It is used as an urinary antiseptic and for the treatment of various chronic urinary tract infections. Urinary antiseptic means if any pain is there during the urination because of the urinary tract infections, then the patient can apply this methenamine or hexamethylene tetramine ointment to get relief from the pain. Next one is phenyl-azopyridine. It is also a local analgesic drug. Phenyl indicates phenyl group. Azo indicates two nitrogens which are attached, that is two nitrogens which are linked with a double bond, that is azo group, and then pyridine ring is attached to this azo group, that is phenyl group, azo group, this one middle one, and pyridine ring, 6-membered ring containing one nitrogen is called pyridine ring. That is the structure of phenyl-azopyridine. It is used as a local analgesic which acts on the mucosa of urinary tract. Local analgesic means it will use as a painkiller which will act as a local analgesic on particular localized area on the mucosa of the urinary tract, so that it can give the relief to the patient. Thank you all.